On a daily basis, millions of people in the United Kingdom rely on the state to support their health and well-being. The National Health Service estimates that on average, 1.5 million patients and their families interact with the expansive range of services they offer each day. In England and Wales alone, the NHS employs 1.3 million people to carry out its core principles. The results are a system that endeavors to satisfy the needs of everyone based on their level of necessity rather than what they can afford. In their 2015-2016 mandate, the Department of Health described the NHS as the fabric that unites our nation, and the single thing that makes us most proud to be British. If the NHS is so integral to British identity, surely a corresponding right to health should exist. The World Health Organization has defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This broad definition was most clearly embraced by the United Nations on December 16, 1966, with the adoption of the Covenant on Economic, Social, and Cultural Rights. Under Article 12 of the Covenant, it is stated that everyone has a right to enjoy the highest attainable standard of physical and mental health. Questions remain about what this right entails, and state parties in particular have found it difficult to determine the scope of their obligations in order to respond appropriately. In practice, even developed nations like the United Kingdom have struggled to keep up with increasing costs. Providing an adequate range of services to address modern medical expectations has meant that yearly health expenditure has risen from £64 billion in 2013 to an anticipated £116 billion in 2015-2016. Austerity budgeting has seen healthcare spending as a percentage of the overall government budget drop below other developed nations, while proposed reforms to the system have raised new questions about the future of a right to health in the UK. We took to the streets speaking to students, passers-by, and medical experts to discuss the state of the NHS today and the perceived impact of such a right to health. The interviews that follow summarize our findings.
Normal experiences, I'd say, was rather good, but when I had an emergency, I wasn't really taken seriously.
Generally, all personal experiences of the NHS have been fantastic. The London Ambulance Service has always been brilliant.
It was so easy for me to just go in there and ask for help and support, and I had several problems, and I wasn't even asked for an ID.
They've all been good, I guess. I've broken a number of bones, and I've been able to go to the NHS and get service quite quickly.
And I'm not British, I'm a Spanish citizen, yeah.
So obviously we work quite a lot together because obviously we're emergency services, so I can't fault them.
So I'm an international student, and when I came to England to study, I was actually I had a rare disease, a rare eye disease, which hasn't been diagnosed back home. So when I came to England, in the opinion of some people, I had to go to the Moorfield Eye Hospital, and they diagnosed this disease. And since then, actually, my health improved, and my health improved significantly.
I believe that the right to health should be a fundamental human right, so it should be enshrined.
Well, I think it should be a right. I think when we took our oath, completing our studies, that was something that we expected to be a given, especially in this country and the National Health Service that we knew we were joining. And there should be equality for all, and healthcare should be attainable. So I think that's why there's a right to it, and it's written.
So if you look worldwide, the WHO lists a minimum standard of healthcare that is required, and that isn't obtained everywhere. Although they do recognise that is a right, that is probably across the world quite deficient. There are many areas where they don't get anything at all. But given the UK and given it's a westernised country, they have the resources and the taxes available to do so.
So I think we should all have the right to access of healthcare, and I believe that's a worldwide thing, and we should all get it. I do think as healthcare professionals, we also have a responsibility to try and deliver that to as many people as we can, and do the best that we can. And I wish that we could deliver the best possible healthcare that we can in this, in 2015 to everyone. And we should continue to do that, and we need to be supported in doing that. Yes, I think in medicine, you can never deliver the highest available healthcare. And actually, I think that's a good thing, because that means there are new things developing all the time. You know, if we were delivering the highest, best healthcare, I get a bit worried about why aren't we doing better? Why aren't we trying to get better? You know, every day there should be something that we're trying to improve. And that's why we have research, that's why we have audit.
In order to provide good healthcare, it can't come down to one single person. So in order to provide good healthcare, you need to have a team to provide that. So my ability to provide a good service on a day-to-day basis therefore relies not so much on myself, but on the people who support me. We have trouble at the minute, and it has always had trouble, with getting adequate staffing levels of all of the other members of the team which I need, such as nursing staff, occupational therapists, play therapists, and so on and so forth.
There's, in terms of already just waiting lists, you know, people here could be waiting. I mean, one of my cousins was waiting a year just to get a gastroscopy, and in Brussels you can book an appointment.
There was a big study done by a Washington, US think tank in 2010, which looked at a variety of factors, including the accessibility of the healthcare system, the efficiency of its funding and how it uses the money available to it. And the NHS came first out of the 11 Western countries sampled. And that was data provided both by patients, by doctors and other healthcare staff, and also by assessment data from the World Health Organization. In addition to this, we spend per person probably some of the lowest of all Western healthcare systems. So to put it into context, the US, with its private system, which therefore doesn't, by definition, help as many people as our public and therefore national health system, still spends twice as much money per person than we do in this country.
I'd say the UK health system is very good value for money. If you look at how much people actually spend on healthcare, we pay one of the lowest amounts of our GDP on health compared to somewhere like the US that pays double. And I think the value for money, I think everyone gets a very good baseline level of healthcare in the NHS. There will be some in the States that get better, but I think the amount they pay for that is disproportionate to the gain they get over kind of a baseline, something like the NHS provides. So as a whole, I think the NHS does provide very good healthcare.
Unfortunately, there's a clause there that's probably not stated on our side, which is within what we're able to offer within our budget and within our capacity and the limitations of resources. So I think that's the one thing that's maybe not stated explicitly.
It's the ability to pull in the right amount of people at the right time. So to put it into context, the actual role of a doctor in healthcare is to make decisions and to perform certain procedures. Most of the actual day-to-day work is carried out by other members of the team, such as nursing staff. So I must admit myself that my contact with any one patient on my ward is probably in a day limited to less than 10 minutes. And the rest of the day, that patient is cared for by other members of staff. If we don't have nursing staff on the wards, if we don't have physiotherapists that can help them cough up the secretions from their horrible chest infections or get them moving, and we don't have the play therapists who can make them comfortable, then my input is useless because there is no one around to actually help me carry out my decisions.
No one works by themselves. We all work in a team, and to deliver a good service we need to use lots of different people's skills to try and deliver someone a great service, and not just a service for today but a service for tomorrow as well.
I think it's always possible, and that's why inevitably we're always engaged in research, in clinical audit and quality improvement projects. It's now written into the curriculum for training, whatever speciality you go into or general practice. Doctors are geared up to have that mantra almost, that they have to improve things and strive for clinical excellence and research and innovation. And that's why we've got government funded programs for that as well, and we've got fellowships for that. So there is always a capacity, and I think that's what keeps medicine at the forefront and keeps it such a dynamic speciality, which is the beauty of it, really.
It's very difficult at this specific point to say anything that would immediately and quickly raise the standard. And I think one of the problems that we face is that over the last decade or so, there's been a slow attempt at trying to dismantle the NHS. So you'll see the Healthcare Act of 2012 was a big step towards that. The changes to the way in which doctors was trained was also a big step towards that. And there have been lots and lots of little attempts to nibble away at the system beforehand. The situation that we're left with today is that the NHS is already struggling to get along. And if anyone had an idea which would immediately improve the quality, it would have already been snapped up by now.
No, I don't think it is. I don't think people. I think in the UK the NHS is massively undervalued. I don't think people realise the cost of health. I don't think they realise how much things actually cost. And I don't think that's helped by the media, because it's free at the point of care, which I do believe it should be. People have no idea how much it costs to see a doctor, how much it costs when you phone an ambulance, how much it costs to be seen, how much the investigations and things cost. And as a result, I think people in the UK have become complacent because it's subjected through the taxes. They don't know how much things cost, and the media portrays that. So I think the media gives the NHS, they only ever report when anything goes badly. Success stories are very rarely reported at all, and those that are normally kind of just back in the pages, whereas you'll find out anything to do with like the doctor's strike or failing NHS, the A&E targets. That's one that's making the news at the moment, because people aren't being seen within 4 hours of going into A&E, whereas if you look worldwide, that's actually very, very good, but it's seen as a failure, and people like to pick up on failures.
I can't really speak too much on that, but the bit I have seen about the NHS in the media hasn't been very positive, and I think probably it exaggerates the negatives more than it does the positives.
One of the things that the current government doesn't seem to understand is that we have a great deficit of healthcare staff at the minute, and that's mostly because the jobs are so unappealing. So if you look at surveys of the average pay which a junior doctor comes out with as compared to most other graduates of similarly sort of long and complicated schemes like law, junior doctors will always fare really quite badly.
People are lowly paid. I mean, what's the incentive for a 17-year-old young adult to go and study 6 years of medical school, 6 years of medical school and become a doctor? I wouldn't, personally.
Postcode lottery is something that is rife across the UK. So that's access to healthcare, medicines, investigations, also specialist doctors and professors, depending on where you live in the country. And I think the actual class divide still exists all across the country, and that does impact on accessibility heavily. Unfortunately, the media have picked up on this, and actually I should say fortunately the media have picked up on this, but have completely spun it to actually portray the negativities of NICE, which is the National Institute of Healthcare and Clinical Excellence, and also the NHS. So Mrs. Jones in city centre of Birmingham has access to world-class cancer drugs for breast cancer, but Mrs. Smith in the Outer Hebrides does not. Instead of actually utilising that in the media to actually, lead the government to actually funding resources and thinking about not sort of spreading out thin resources already even further, but actually targeting areas and allocating resources more specifically, I think the government have just spun things out of control, and that just leads to patients that are more demanding and not realising that actually they have access to a full range of facilities, and those that are sort of not well and more needy and maybe even living in poverty, just not knowing what else they could have access to because they just don't demand it.
Perhaps there's an argument that we should be contributing more and working with the media in a bit more closely to try and deliver some of our ideas about health to the general public. You see a lot of people come into hospital with very misguided ideas that have been perpetrated by the media over time, and sometimes I think that as healthcare professionals we probably should have a better liaison service with the media and actually use them to our aid and to the public's aid in a better way. We have a lot of journals that, to be honest, we're the only ones who read, and perhaps we should be writing things
filter into the Daily Mail.
Yeah, perhaps we should be, so other people can read them and think, this is actually something else to have a read about rather than some scare story they read in the Daily Mail.
From our various discussions, the absence of a domestically incorporated right to health has not negatively impacted the perception of healthcare in the UK. People exposed to the NHS in a range of contexts seem satisfied and sympathise with the difficulties such a service must overcome. A positive outlook persists despite reduced funding allocations and a worsening imbalance in the quality of services offered across the country. This would seem to directly contradict the state's duty to ensure the progressive realization of Article 12 of the International Covenant on Economic, Social, and Cultural Rights, and may even constitute a retrogressive step. Yet Article 12 is so ambiguous it is difficult to contest any shortcomings of the NHS, and without proper parliamentary incorporation, enforcement may prove difficult. Nevertheless, we found people believe these shortcomings were mitigated by the acceptance that nothing can be perfect, awareness that the NHS must contend with a rapidly increasing population, making such a standard highly precarious or even untenable, and the assumption that the government is already doing its best. While it is true that the NHS compared to many countries would be considered a luxury, an enviable system should not invite complacency on the part of the UK government. While it must be acknowledged that the realization of a right to the highest attainable standard of health requires a great deal from all states, the link between our health and overall well-being must not be undervalued.